Good afternoon, everyone. I'm Dave Grandy, the Director of Policy at Penn's Leonard Davis Institute of Health Economics. Welcome to our Penn LDI, what I will call our not-so-post-election discussion. As you all know, vote counting is still underway. I trust if a winner is announced in our home state of Pennsylvania during our discussion today, someone will let me know. I'm sure a few of you out there are keeping your browsers refreshed. We always knew Pennsylvania would be important in this election, but I don't think we realized it would be as front and center at noon today as it is when we planned this event. But here we are, certainly front and center in Pennsylvania. So our focus today is to talk through the implications of the election, both what we know from the campaign, as well as the anticipated political alignment of the federal government in 2021. And so we have three outstanding panelists today that I'm going to introduce. First, we have Allison Hoffman, who is a professor of law at the University of Pennsylvania Carey Law School. Her work examines the Affordable Care Act, Medicare, and retiree healthcare expenses, and Medicaid and long-term care. And Allison has written extensively on health reform, the public option, employer-sponsored insurance, and will help us understand what role the Supreme Court may play in the near future. Dan Hopkins is professor in the Department of Political Science at the University of Pennsylvania, with a secondary appointment at the Annenberg School for Communication. His research examines American political behavior and policymaking, including the role of the media in shaping public opinion towards healthcare reform. And I must confess, I've been following Dan Hopkins on 538 this week, so he's a contributor there as well. And Mark Pauly is the Bentheim Professor in the Department of Healthcare Management, Professor of Healthcare Management and Business and Public Policy at the Wharton School, Professor of Economics at the University of Pennsylvania. He is one of the nation's leading health economists and is currently studying how insurance affects the growth of medical spending. So we have a great panel here. Certainly our discussion couldn't be more timely. And given where things stand right now, I actually want to start with you, Dan. I know you've been following the election very closely, as are, I'm sure, many of our viewers today. But before we get into anything about healthcare, what do we know about the state of the race at 11:59 this morning?
So as of right now, best we can tell, there are, at the presidential level, 4 states that remain in play, and those 4 states will decide who is the president. For different reasons and to different degrees, Joe Biden is favored in all 4 of those states, though the major media outlets that traditionally call these elections say we now project that Joe Biden or Donald Trump will be the next president, are at this moment holding off. This morning, Joe Biden took the lead here in Pennsylvania on the strength of mail-in ballots, and because there are likely to be more than 100,000 mail-in ballots still outstanding, Joe Biden is expected to win this state. Now, of course, this was a most unusual election with a lot of people voting for the first time and voting using new methods. So that's not a projection that any of the major media outlets have yet committed to. But that's I think far and away the most likely outcome. Nevada also has not been formally called, but Nevada, with its 6 electoral college votes, looks like it is trending, like it is very, very likely to be Democratic. In Arizona as well, with its 11 electoral college votes, President Trump has been closing margins as they've counted ballots recently. And it is certainly still possible that President Trump will overcome Biden's current lead, but I think the expectation is that Biden will probably maintain his lead. And then finally, Georgia has been razor tight. And Georgia is likely to go to a recount if one is requested by the president or by either of the candidates. But Joe Biden is very, very narrowly ahead, and there are very few ballots left to count. So I think at this moment, the expectation is that barring a very, very unusual set of events, I think Joe Biden should win the states that would get him over 270 electoral college votes and make him president-elect. But we don't know when that will happen. And I think given all the uncertainty around this election, the major media outlets are being hesitant before they make a call.
Thanks, Dan. I thought you were going to tell us the exact time that we could expect a decision, so I'm very disappointed. I'm just kidding, but I think it's impaired a lot of economic productivity in the United States this week, given that we're all just kind of watching these vote counts come in. So Dan, I do want to come back to you to pivot from this conversation about the overall state of the race to what we know about the role that healthcare played during the campaign, what we ultimately think the role was in the actual election itself, and if there's some message that the electorate sent about healthcare.
I think one of the first things to say is that on some level, obviously, healthcare is on everybody's minds, and this was a healthcare election insofar as the coronavirus was one of the central issues. It was a critical backdrop, and insofar as that is a healthcare issue, I think that this is very clearly front and center in many people's minds. That said, an important thing to know about political psychology, about how voters think, is often issues are much more discrete and separate than you might have expected. And so this was not a healthcare election in the sense that large numbers of voters were telling us that healthcare was their primary concern, right? Given coronavirus, given people voiced their core issues in different ways. That said, healthcare has been one of maybe the central battlefield between the two major political parties for the last decade. And you could argue that 2014 and certainly 2018 were primarily about healthcare. We know too that the two parties have taken turns mounting legislative offensives and then reaping the repercussions of that. So the Democrats obviously passed the Affordable Care Act, which initially was unpopular and which very likely cost them some support in 2010 and possibly in 2014. But then when Trump and congressional Republicans moved to repeal it in 2017, public opinion shifted and became significantly more pro the Affordable Care Act almost immediately thereafter. I think the one other key thing to say in response to your question, David, is just that, of course, health policy attitudes are not just ACA attitudes. And so one of the things I want to stress is that to know how the public feels about the ACA is not the sum total of everything that the public thinks about healthcare.
One of the most imminent things, even well before, like if there was an incoming Biden administration, for example, one of the most imminent things to emerge after the election is the Supreme Court case, actually, related to the constitutionality of the Affordable Care Act and the individual mandate, now that the penalties have actually been repealed. Allison, I'm going to turn to you as our legal expert here to help us understand what is at stake in that case, and what I know the court is hearing the case as soon as next week, but what is both the questions before the court as well as the timeline that we might see come from them hearing the case?
Yep, I'm happy to talk about that. It's such a pleasure to be here today with you all, and I don't think that next week is going to be a lot calmer than this week, because this case will be argued in front of the Supreme Court next Tuesday. So for those people who follow legal developments, next week will continue to remain a really important week. So the court is hearing again this question of the constitutionality of the individual mandate, and it's a two-part issue. So the first question they'll think about is, again, like we heard in the case that was decided in 2012, this question of whether the mandate is constitutional. And then the second part of it is, if no, can the rest of the law stand without the individual mandate? It's, in legal terms, it's called a severability analysis. And so there are a lot of different ways this case could go. We will get some sense of that based on the questioning on Tuesday, but I don't think we'll get a decision in the case likely until June. That's often when the Supreme Court announces its most momentous decisions of the year. The first question of whether the individual mandate is constitutional or not is unlikely to have a lot of significance on the ground. The second question is more important. The question of if the mandate is unconstitutional, must the entire law go? And on this piece of the inquiry, what the court is supposed to do is ask what Congress would have intended. Now, most legal commentators think that that answer is very clear because Congress zeroed out the mandate in 2017 in the Tax Cuts and Jobs Act and left the rest of the law in place. So you ask what Congress intended, and you can look and see what they did in 2017. It seems pretty obvious to most people. And so, it may be that the court looks at it and says it's obvious, and it may be that the analysis is more complicated than that, and they try to figure out what Congress intended in a more complicated way. One thing Congress could do is make it crystal clear what they intended by, between now and sometime when the decision comes down, adding a small clause to the law that says, if any part of this law should go, the rest of the law should stand, a severability clause. Will Congress do that? It depends what happens in what looks to be 2 runoff elections in Georgia in January, and possibly the Alaska Senate seat as well, and who's the majority leader in the Senate. So let me say one other thing about this case is that we could see something unusual in terms of kind of what has happened up to this point in the case, where the court decides the case on procedural grounds, doesn't even get to these substantive questions. And that would be that the court could look at this and say that the parties that brought this litigation are not in a position to bring this kind of case at all. So to bring a case like this, you have to show that you've been harmed by the mandate. And so the argument is that the states that have filed and the individuals have been harmed by a mandate that has 0 penalty. Have to believe that people out of the good of their hearts comply with the mandate even without a penalty in place. So far, the courts haven't bet on that argument, but the Supreme Court could look at this and say nobody's been harmed by a mandate that has no penalty, and thus this case has no grounds to stand on, and they could toss it out on those procedural grounds. We may get a better sense of where the court's leaning on Tuesday, but I don't think we'll know for some time.
So it sounds like we're unlike, I guess the nature of the discussion in the court on Tuesday may give you some inkling, but it's really not till June that you would really have any sense of where the court stands on the issue. So in terms of Congress needing to potentially intervene in the interim, I guess the way the timing works out, they wouldn't really know until June. And so if the Congress were to intervene, it might wait.
It might wait. Congress might wait. It might also be that, that Congress decides not to wait until the court has issued a final opinion in order to essentially make the outcome of the case clear.
Great, thank you. So let's talk about other policy prospects in this incoming Congress and administration. Again, we don't know the result. There's still probably a fairly high probability of having a situation of divided government in some fashion. Certainly if there's an incoming Biden administration and somehow the Democrats win those couple of seats in Georgia, they could potentially come in with the thinnest of majorities. But a lot of things would have to fall into place for that to happen on the Democratic side. So imagine we're in the situation of divided government. What might we see emerge as potential policy options in healthcare? And Mark, I'm going to turn to you first. Obviously Biden ran on making substantial changes to the Affordable Care Act and really building on the Affordable Care Act, expanding the subsidies, both in terms of who can get them as well as their generosity, and then also talking about adding a public option into the Affordable Care Act. And so if we're in the situation of divided government, what do you see as potential things that Republicans might be willing to compromise on or to negotiate on in terms of some future directions?
My guess is very little, actually. So I would predict, of course, it all depends on what happens with the court case, as we've just heard, but assuming at least for the next 6 months, the law remains in effect, and I think the smart money thinks that the Supreme Court will not decide to throw out the Affordable Care Act root and branch. I think the chances of legislative agreement on much of anything are pretty slim. Probably more likely, the most important changes would come from a Biden presidency rolling back the executive actions that Trump put in place, largely having the effect of creating insurance options alternative to the ACA Act to allow people who were low risk to have an end run around community rating as mandated in the Affordable Care Act. So that's the big change that I see actually happening. In terms of legislation, well, it depends on what is a Republican these days. And frankly, I'm as puzzled about that as anybody. I used to be a Republican and I thought I knew what they were, but I don't anymore. But I think the punchline is that the only thing I could see agreement between Trumpism anyway and the Democrats is they both want to do something about drug pricing. Maybe you could have some action there. Although my particular point of view is I don't know whether drug prices are too high or not, but I know that nobody else does either. But maybe there could be agreement and some easy to pick off things like price billing and a few cosmetic things like that might matter. But I would expect a legislative gridlock and preserving pretty much the ACA in its current form, which frankly is okay with me.
Dan, what do you see as, there's been this, as you said, this standoff over the ACA since its passage. It's been a battlefront. And is there any way that getting now 2 steps removed from the Obama administration, although now we have, if it is a Biden administration, certainly connected back to the Obama administration, is there, I think people have hoped that the further we get out from passage, and there was political cost to trying to repeal the ACA, that maybe there would be an opportunity to negotiate over some policy aspects of the ACA. Do you have any hope that that could happen?
Well, I think one thing that I've certainly had my eye on as to whether there's going to be a kind of mass level ceasefire with respect to the ACA is when solidly red states, whether it's Florida or Texas or other places, legislatively pass a Medicaid expansion. And I think that's one indicator that we may be moving beyond the most contentious element of the ACA's politics. That said, I do think that the ACA for more than a decade became kind of the creedal battle between Democrats and Republicans. And I do think that there's a lot of space, building on some of Mark's points, I think there's a lot of space under the radar to negotiate shifts within broader budgetary agreements. For instance, the United States continues, whether it's through the budget process or through continuing resolutions, the United States will continue to spend money, probably at a fairly fast rate. And there are, in terms of directing those payment streams, there is some leverage that both parties have. And I do think that there are a whole set of issues that you could imagine not rising to the front pages or to the top of people's news feeds, on which you could imagine some modicum of progress, right? And I think Mark did a good job laying them out. But I do think that we are certainly unlikely, even if the Democrats were to win those two seats in Georgia, we're likely in for a very incremental period in which we're not going to see wholesale changes. And I think, if the Democrats had picked up 2 or 3 or 4 more Senate seats, we'd be having a very different conversation right now about the possibility of a public option, or the ACA was I think referred to by Tom Harkin, the former Iowa Democratic senator, as a kind of starter house, and it seems like it's kind of the starter house that we'll be living in for quite some time now. But I do think that there is some political room for tweaks on the margin.
I think Mark alluded to the executive orders from the Trump administration and what, if there's a Biden administration, what can they do without Congress is the question. And so certainly Trump pursued a number of executive orders. Allison, back to you. How do we think about executive orders? What are the boundaries around where an executive order can be used to change policy? And what might we see from a Biden administration?
The administration can actually do a lot without Congress doing anything. I mean, the Trump administration has taught us that, and the Biden administration will remind us that. So there are 2 tools that they'll have. The first is the executive orders. Executive orders do things like they deal with emergencies, which is obviously relevant at this particular moment in time, and enforcement of laws. A lot of Trump's executive orders, what they did was they said to the administrative agencies, they set a direction for regulatory action. So that's the other tool, is what can the agencies do through regulation? And the answer to that is that they can do a lot. And so we'll see, actually, I think we'll see an executive order fairly quickly from the Biden administration to reinstate the status of top policy civil servants. Trump just signed an executive order into place that would essentially change the status of some of the top policy officials in the administration to make them at-will employees, and it goes into effect the day before inauguration, and it would create job insecurity for many of the top officials in the civil service. And so I think we'll see an executive order pretty quickly to undo that one, and then they'll turn towards healthcare. And in the healthcare space, largely through regulation, what we'll see is first an eye on the pandemic. So things like COVID testing, treatment, vaccine approval, distribution, spending money that Congress has already appropriated and allocated for COVID response. The administration will be able to do all of these things. Then we'll see, secondarily, an undoing of years of regulation by the Trump administration that has reduced people's access to medical care. So that includes things like in the Medicaid program, revisiting work requirements, revisiting the recent approval of a waiver to Georgia that allows them to opt out of healthcare.gov and will reduce the number of people who sign up for ACA coverage in that state. We'll see what Mark alluded to earlier, addressing the erosion of individual coverage by allowing non-ACA compliant plans through rules on things called association health plans and short-term health plans. We'll see them turning to Title 10, changing the rules there that were intended to block Planned Parenthood from taking federal family planning money. And 1 in 4 sites left the program after those rules went into place. We'll see a turn towards the public charge rule that for the first time historically made things like Medicaid and participation in nutrition assistance programs considered as part of what would categorize somebody as a public charge and could then harm their immigration status. We'll see protections for LGBTQ care through non-discrimination provisions revisited, and a return to a lot of the Obama administration interpretation of those rules that say things like sex discrimination includes discrimination on the basis of sexual orientation. We'll see a turn to nursing home regulations, which we now know are extremely important in light of COVID and the impact on nursing homes, mental health and substance abuse. So I could go on. I will stop here because I think it gives you a sense that a lot can be done through regulatory action, and the Biden administration, I suspect, will turn towards a lot of these things pretty quickly.
There's one question that was submitted that I want to pull into the discussion here to see whether or not, obviously we were just talking about a public option earlier about like moving something like that forward would be difficult, modifying the subsidy structure. Somebody asked, what about Medicare buy-in for people less than 65? Is there any prospects if Biden wanted to do something, pulling down the eligibility age for Medicare and some sort of buy-in arrangement? Could any of you anticipate any political traction for a policy like that?
So that would have to happen through Congress. That could not happen through administrative action. So I would look, to Dan to tell us whether I think it's unlikely, but I would look to Dan to tell us whether he thinks that you could see some kind of bipartisan compromise in that regard.
Yeah, it's a great question, and I wish I could offer an more optimistic assessment. And I do, by the way, just want to say that, David, we should come back because Allison's list was really comprehensive, and so I'd love to, let's do this again in 4 years and see how many of those items have been checked off if Biden is in fact the next president. I would love to do that.
I predict all of them.
Yeah, I would say no Republicans I've talked to or heard from would be interested in having a Medicare cover more of the population than it now does. Now, of course, Medicare actually is an interesting example now of a public option where there is a public option in Medicare, and there are also a lot of private options in the form of Medicare Advantage. And the private options at the moment are kind of beating the public option pretty decisively in terms of growth and market share. But I think the public option as well is viewed as anathema by most Republicans, even those who are ostensibly in favor of competition, but they are worried about the kind of competition that might ensue if there was a public option.
Yeah, just to add very briefly to that point. So a couple quick reactions. I do think that this conversation, like so many conversations, has been very federally focused, and I wouldn't be surprised if, given the fact that in all likelihood we will have divided government, I wouldn't be surprised if some of the organizing is focused at the state level. And obviously, Vermont's attempt to move in a very single-payer direction in 2014 ended poorly. I think it was 2014. But I wouldn't be surprised if we see some level of state-level innovation. But just to talk about the political mechanism underpinning Mark's pessimism, which I think is quite reasonable, the basic problem is that American politics is super competitive right now, right? This is why we stay up late, because we genuinely don't know who's going to wield power. And every election, every federal election going back decades has had uncertainty about either who's going to control Congress or who's going to control the presidency. Right? We have been genuinely unsure of the answer to that question. And that's going to be true in 2022 as well, right? So traditionally, the party that holds the presidency doesn't do very well in midterms. And the Democrats recently have faced increased hurdles in winning Senate seats. So even in years when they win the presidency or the House, they have sometimes lost or not won many Senate seats. And I think the fundamental challenge is that with 2-year federal cycles, almost always one of the two parties has more of an incentive to hold out and wait for more power, right? We didn't even pass a stimulus bill, this summer or this fall, even though there was widespread bipartisan agreement, precisely because both parties wanted to wait to the election. And now there will be a significant incentive to wait till the next election, right? And we will be perpetually waiting for federal elections because they promise to change the balance of power in a way that, when coupled with today's very hyper-competitive political environment and hyper-polarized political environment, makes it almost impossible for one party to do anything that would be seen as giving the other party a win. And that's why some of the most significant accomplishments are ones that seem to happen under the radar and without much fanfare.
Wow, you're really making a case for gridlock as being highly likely. I think people hope when there's a national election that there's a little bit of a brief moment of reset and creating some policy opportunities, even if the window is relatively short. Do you think there'll be any window, Dan, where there's some opportunity to do anything in a bipartisan way?
We are certainly at an inflection point, but I think that if you, my tracking of, say, key Republican senators suggests that there is not going to be significant appetite for, we may well get a sort of broad omnibus COVID type bill, but we might not. And I think that given that the U.S. political system is designed with a whole number of veto points, so that you have to have essentially supermajoritarian support to really move policy in your direction, that coupled with these ongoing political incentives to play to whether your Fox News audience or your NPR audience, I think means that I could imagine, deals on the margin and the kinds of tweaks that could still have real meaning in millions of people's lives. But I think that the minute they hit the front pages and the minute both parties start to think of it as a definitional issue where they have to oppose the other, zero-sum dynamics take over.
If I could offer a thought here, I think the most striking thing to me from the election had to do with, and my most incorrect prediction, had to do with the role of COVID. I had thought, and that part was right, COVID, according to the exit polls, was a major concern. But I thought that there would be a landslide for Biden because of Trump's mismanagement of the pandemic, and that apparently didn't happen. And so I personally am somewhat upset about that. As I said, I used to be a Republican. I think I know what people in middle America think, but now I'm not sure I know, because almost half of Americans continue to support the president and presumably also support his policy when it comes to COVID. But that actually will be an interesting thing to see, because let's say President-elect Biden has said he's now going to listen to the health experts, not the health policy experts, but the health experts, public health experts, and we'll see how far that gets, whether the opposition to basically public health intervention by a large number, by the president and by his supporters vociferously, whether that will melt away in the face of, I have to say, the logic of public health intervention, and where Republicans, members of Congress now, will fall on that score. Will they go along with science, or will they continue to maintain a position based on no science whatever, and various sorts of conspiracies and wishful thinking and so forth? So we could get, and I think Dan mentioned, we could get some real action on COVID. Golly, the Lord, I wish the Lord would help us do that from at least our current pattern. And of course, much of what our current pattern is due to is the result of executive actions, which I assume will be reversed, and more scope allowed for public health authorities to do things. They don't really require legislative action, but the more fundamental problem of what kind of country we are and who are these people is, I think, one that, to put as positive a spin on it as you can, it'll be interesting to find out.
I just have a couple thoughts, because I think that one of the challenges is precisely that America, many millions of Americans, are now in this kind of state of hyper-political engagement, where, exactly as Mark had said, they are reading into these election returns the meaning of America. One of the challenges is that we are now a tremendously diverse country, right, which spans 3,000 miles, and many, many different people who vote for different reasons. And I think, so I would caution us against kind of reading any one single narrative into the election. It could well, so I would also point out, I'm 42 years old. This is the first election in which I've been eligible to vote when an incumbent president has lost, right? When incumbent presidents lose, it is typically relatively narrowly, obviously 1980, the other exception, but my sleep-addled mind can't immediately remember what the previous election before 1980 was when an incumbent president lost, right? It just doesn't happen that frequently. It might just be 1932. I'm sure somebody will jump in the comments and name another. We can argue about 68, but basic point holds. An incumbent president losing by 5 percentage points in an era of widespread polarization is, I think, itself a significant turning point in the direction of the country. And I also would say that incumbency has significant advantages. If you spend 4 years, even if you are saying things that are interpreted by millions as negative, that level of familiarity helps build support and helps, build a level of kind of recognition that is hard to defeat electorally. So I think that if current electoral trends, as of when this conversation started, hold, and Joe Biden is elected president, I don't want to understate that does represent a real break in the direction of the country that voters are sending us. But I also think that voters basically just get one choice, right? Imagine having a phone conversation where all you could say was yes or no, or one or two, or Democrat or Republican. And I think it's very, very hard for voters to articulate much nuance if you ask them simultaneously, what do you think about COVID? What do you think about the economy? What do you think about taxes? What do you think about foreign policy? Yes or no, D or R.
Yeah, it's interesting, Mark, you brought up COVID and kind of where COVID was situated in the broader election. Certainly the country is facing an enormous surge in COVID right now that's much more widespread than what it was certainly back in the spring. One could imagine, I mean, I think people wake up after elections and they're imagining that somehow inauguration is tomorrow. If there's a change in administration, we're still 2.5 months away, just about, if there is an incoming Biden administration, and a lot will happen related to COVID during that time period. So if we were to just think about a couple of scenarios, certainly we could be in a place where there's a lot more COVID cases and mortality through a pretty difficult winter by the time we get to late January. we could think about the fact that there could be, if all goes well, approval of a vaccine that would not be widely available by the time of inauguration. But if we think about where the country will be in late January, the COVID situation could be quite a bit worse by then. I guess a question to any of you is, how does that change things to people? Do we anticipate, is there any way to galvanize the country again around collective action around COVID, or because it was part of the election and became a partisan issue, is the kind of train out of the station already?
Well, I think I agree with Dan that we as voters are given not only a relatively narrow question, like yes or no, but also a relatively narrow window in time to express our preferences. And so I imagine what will happen over the next 3 months is not going to be very much affected unless there could be demonstrations. There seems to be more proclivity to that. But except for that, I don't imagine the opinion of the population is going to be as important as what the politicians can agree or not agree on, and also what legal constraints might bind them in terms of course, what I think is the major issue, which is reintroducing public health sanity into the discussion of what to do about COVID, whatever happens with the growth of the number of cases and the availability of a vaccine. I'm not optimistic about sanity returning until late January, but maybe I've been wrong before, and maybe I could be wrong on that.
I don't know if it will return then, Mark. I think you're right.
Yeah, maybe not. Maybe not.
One really challenging piece is that I do think the situation will worsen, and Biden will inherit it, and people will have even more COVID fatigue than they do now. And whether Biden and his team announce something federally or not, even as the states are putting restrictions into place, people are resistant to seeing that happen again, even at the state level, and which is typically the level where that kind of public health regulation does occur. The other thing that is really problematic is that Americans need another relief bill. We have a lot of people who are still out of work and are coming to the end of their of their relief dollars. The ban on evictions is coming to an end. I mean, there's a number of provisions that need to be addressed now, and I can't imagine that this Congress is going to act between now and inauguration. And even if they did, I could imagine that then lame duck President Trump may not sign it into law. So I think we'll see things worsen considerably, and assuming that Joe Biden is inaugurated in January, that he will face a really tough situation that will take up a lot of his time in the early months, maybe years of his presidency.
There was actually a question in the Q&A here asking whether there's any actions that could be taken by the Trump administration between now and if there was an incoming Biden administration at inauguration that may harm or hurt Biden's chances in terms of various healthcare policies. So do we think during this lame duck period that there could actually be some further executive orders or other things done in the executive branch or anything legislatively?
That's a part of normal politics, even during a normal transition of power, is you see a rush of regulation and executive orders and other things leading up to an inauguration. And so I could say with great certainty that we'll see that now. And then you see the next administration come in and have to address a lot of those last minute, those last minute regulatory actions. That I think is likely. Certainly.
One thing that I think will be interesting to watch is, even in the interim, maybe even especially in the interim, there's the health dimension of the COVID pandemic, and then there's the wealth dimension of the COVID pandemic, what impact it has on the economy. And most of the estimates of the initial impact were very striking, that it really, as everybody knows, I think, knocked the props from under the economy at the time. But it is my impression that at least some important segments of the economy are kind of learning to cope with COVID. Now, of course, a total shutdown would be a shock to the economy too. But if that doesn't happen, The question may turn on whether or not the bulk of the economy can be resilient enough to continue to do what it wants to do, which for some people is to make profits, and for other people is to make income, and for other people is to get products, and how that's going to proceed as the epidemic apparently doesn't go away tomorrow, but continues to progress. What's that reaction going to be? I suppose meals away from home spending there is going to continue to be down, and likewise airlines, but other kinds of parts of the economy seem to have recovered fairly well. And I'm certainly not going to say we should look to the stock market, but maybe we should look to the stock market, which has been fairly optimistic. But I think personally overly optimistic. If that was true, I would be outselling my stock, and I'm not. But I do think that the evolution, we may see a much greater indicator of how things are going in the economic data than in the political data over the next 3 months, or for that matter, thereafter.
And Dan, I want to let you know there's a couple responses in the Q&A to fact check on incumbent presidents.
You're going to say 76, right? You're going to say 76, and we can talk about how Ford counts given how Nixon left office.
Okay, well, yeah. So we've got Bush Sr., Carter, and Hoover in the past 100 years, is at least according to Pete Groneveld, our contributor. There was a question in here related to CMS. And I think it's an important question because there was a lot of policy directions that emerged from the Obama administration in CMS. A lot having to do with various ways of making modifications to payment models, creating new incentives in the healthcare system. And the question is, do we anticipate, what kinds of changes might we anticipate coming out of CMS? In some sense, there was many things that were actually continued during a Trump administration from the Obama administration, and certainly some departures. What do you see as the future directions at CMS, things that may be new directions, things that may be cast aside that were started during the Trump administration?
I think we'll see a turn back of the approval of work waivers, and we may even, before they get to that, we may see the court decide that they are in fact illegal because not consistent with the basic contours of the Medicaid program. There's a case that's working its way up to the court on that now. Although with this particular Supreme Court, that may not happen. And then I think we'll see a whole range of reconsideration of regulations. I think we'll see continued work on, especially after COVID, on nursing home regulations. We'll see, even if we don't see new regulations in some area, we may see increased enforcement. So that would happen in the nursing home space. I saw a question on mental health and substance abuse parity, or substance abuse floating in the Q&A. There's a lot that Biden has said he's going to do in that space, but one is to enforce the parity laws that haven't been well enforced so far. We may see other kinds of small waiver provisions that have been approved by the Trump administration. I think we're likely to see a Biden administration pull back on those things that require, for example, co-payment in the Medicaid program to get care, and other provisions like that. I mean, I think that there's a wide range of regulations, some of which are kind of heading in a direction that it has greater consensus, and a lot will see reversals of Trump administration policies.
Well, personally, I'm very focused on that, as I'm terrified to go on Medicare in the very near future. What's it going to be like? I think one thing there will potentially be action on is government involved in the bidding of bids for prices for drugs under Medicare Part D. I think that goes along with even some Republicans wanting to at least do something about drugs, if only for populist reasons. So there may be, we'll at least test the hypothesis of whether the government is better at negotiating lower prices for drugs than the private Part D plans are now. The other thing is, I don't know where this is going to go. Medicare has tried to rearrange itself with ACOs and bundled payments and other kinds of demonstrations over the years, and even changes written into law. My strong opinion is most of them have been duds. They haven't done a lot of harm, but they haven't done much good either. But hope springs eternal that there's a new way of rearranging how to pay doctors and hospitals that somehow can do more harm than good, or maybe even only do good and no harm at all. That's the politician's nirvana. And there may be some attempts to do that. Everybody's got an idea. And even though, most things haven't worked out all that well, that's not a reason not to keep trying. So I'm a little bit worried about being an elderly guinea pig, when I go on Medicare, but I think there will still be a drive for a lot of experimentation of alternatives to especially in the original Medicare from the federal level, and probably under a Biden administration compared to a Trump administration where they were more willing to let, insofar as anything was ever rational there, let innovation be the bailiwick of the Medicare Advantage plans. There will be, I think, an attempt to see if original Medicare can, for once, come up with something. Well, ever since DRGs, that was the last success. Speaking of, it seems like just yesterday to me, but that was 40 years ago. Maybe there will be, I think, a lot of ferment in the part of the health system, which, after all, is the government's primary fiscal responsibility, which is Medicare.
Mark, the one thing I would add to that, I agree with that. And I think the question of how do you promote value in the Medicare program seems to be a perpetual one that nobody has cracked that, not yet. But on the drug pricing, the major change there, allowing the government to negotiate prices, would require Congress to act.
It would require legislation, yeah.
Yeah, I don't know.
But Republicans might go along with that. At least Trumpists might.
Yeah, that was actually I wanted to come back to drug prices and wondering if the government was to get more active in negotiating prices, do we think, is it a Republican president that has to make that happen, or can a Democratic president make that happen? I'm going back to, I guess, Dan's question. If it comes from a Democratic president, does it become harder to move something through? It seems like some of the momentum for doing something on drug pricing came from the fact that it was coming from a Republican president to a at least partially Republican Congress.
Well, it is true that, President Nixon was the primary advocate of price controls, and for that matter, of national health insurance, until the debacle in the tidal basin wiped out political support. Nobody else but me probably remembers that. But it's a question again of whether who is a Republican. If it is continues to be the party of Trump, he was, I think, potentially agreeable to having something like that happen. Of course, he was more agreeable to having it happen if he could have taken credit for it, and maybe, as usual in politics, the original idea of Obamacare was the Republican idea of George Bush the First, which I played a small part, declared dead on arrival by the Democrats, and then reversed through Romney, after being sanitized through Romney Care, to becoming a Democratic idea. I still think it was a great idea, but the punchline is that it is conceivable to me that there could be legislative agreement on, particularly if, the question is what you forecast here. If drug prices, they're actually not overall increasing all that rapidly, and drug spending is even more under control, quote unquote, lately than it has been for years and years. But if the dam should break and all of a sudden we got to double-digit increases again, particularly for Medicare, which can hardly stand it, then there could be, I think, some bipartisan approval to put a lid on the boiling kettle and see if that works.
I was just going to add very briefly that I think an unfortunate byproduct of the age that we're in is that policy experts need to not only be expert in policy, but also need to have a lot of political sensitivity about how do you design a policy that is going to not be subject to the kind of sustained attacks, both elite level and sort of in public opinion, that the ACA was subject to. I mean, it's hard to realize now, given how important a piece of the Affordable Care Act, the Medicaid expansion, has become. But originally, a decade ago, the CBO projections were that the exchanges were going to wind up covering many more new people than were the Medicaid expansion. But partly Medicaid expansion had a kind of simplicity and a durability, both, and Allison could say so much more about this, but it certainly, though it came close, had less legal liability, and it also had a kind of political support that means that Medicaid expansion has actually been passed by voters in a variety of solidly Republican states. So I think that it is a product of the times that we're in, that when designing policy, we need to not only think about how that policy is going to work if fully implemented, but how might this policy work in a very hostile political environment as well.
Another question that was submitted, it's asking the question, is there an opportunity in mental health? If we think about issues that the country might be able to galvanize around, maybe something that doesn't naturally fall into our polarized, view of policy and politics. Is there a way that mental health could be embraced and become one of those areas of bipartisan agreement?
I guess there's two questions there, Dave. One is whether it could become an issue of bipartisan agreement, and maybe Dan might have more to say on that, but whether something will be done about it, regardless of whether it does or not, is a yes. The Biden administration, if you look through the Unity Task Force plan, you see discussion of efforts on mental health policy throughout the plan. So it's peppered in pieces, thinking about funding in the criminal justice system for mental health treatment. It's a part of helping states pay for mental health in the state Medicaid programs, thinking about just increased for federal funding for the agency that works on mental health regulation and parity, increased enforcement of mental health parity. I mean, I do think where Dan left us off as well, if you're thinking about issues that could gain kind of bipartisan support over time, I think the Medicaid expansion could be that. He mentioned that in states where Republican governors or legislatures had blocked expansion, the electorate has been voting for it and essentially overturning the decisions of their elected representatives on that particular issue. And with the pandemic, we see the importance of all of these issues, right, of mental health treatment with the intersection of the pandemic and the opioid crisis, and the importance of Medicaid expansion when people are losing their job-based coverage are gaining increasing salience and importance. And so I could see those kinds of issues, gaining a lot more attention and potentially gaining increased bipartisan support over time.
Yeah, I think there is to me an interesting parallel between Medicaid expansion and what's been happening there and what originally happened with Medicaid, which was that many states did not originally participate in Medicaid, but gradually the dominoes fell, largely motivated by an unwillingness of people to pass up those quote unquote free federal dollars that were being offered to their state, principles to the contrary be damned. So they went ahead and expanded Medicaid, and I think that's what we seem to be seeing now, and under the same sort of set of incentives. And that will do a lot of good for obviously for the population eligible and for closing the gap of the remaining 10% of the population that's uninsured. In my view, the only other thing you'd need to do to close the rest of the gap to European levels would be to have an individual mandate with teeth to it, but I'm not particularly forecasting that in a divided government, because it's, like being a terrific idea, has gotten a fairly bad reputation. But that maybe on the mental health issue, I think what would be needed there is bulletproof evidence of high effectiveness, that there's some way of doing things differently or doing things more in the mental health arena that are actually going to produce substantial improvements in the health of important parts of the population. Substance abuse would be the obvious target there. If somebody could come up with the, I hate to say magic pill, but some thing that really works, I don't see a sort of supply-driven dynamic of more funding for mental health care just because it's a good thing. I think politicians are, especially in a constrained world, in a world where they have to agree, you need to beat them over the head with a 2x4 that says, look, here's something you could do for not that much money that would do an awful lot of good. And the 2x4s have already been invented in the construction industry, but not really in the political industry.
If I could just jump in for a very quick second. I think, Mark, if you want to see the individual mandate come back, what I would suggest to you is pitch it as a way to fund the wall, right? If every dollar of the individual mandate goes into a wall on the U.S.-Mexico border, but I say that obviously jokingly, but I have done a lot of survey work on different kinds of compromises, cross issues that people would support. I mean, Allison can tell us, but I think that may solve the legal challenges too, because the individual mandate wouldn't be zero anymore. But anyway, but my broader
forgoing the individual mandate and increasing the subsidies in the exchanges. I mean, that's one area where I will be watching carefully to see if Congress might be willing to act in a bipartisan way to increase those subsidies, because we know that most people who have bought coverage so far have done so based on carrots, not sticks. So that I think is one.
Right. The individual mandate is really a substitute for subsidies, but it's a less pleasant one, and so that's been its fate.
And it's one that generates a lot of unpopularity. I mean, when I look at the data, the individual mandate generated a lot of pushback. And on the flip side, what we've seen is that over time, the exchange population has always been heavily subsidized, but even more so, right? The people who are using the exchanges now, I think north of 85% of them are subsidized.
Yes, that's right. Although there's another, about a third of people off exchange buying individual insurance who are not subsidized. And I will say, because I mentioned this in my recent New England Journal commentary on a potential Trump win, but the part of the health insurance system, which I think is now most under threat, is the off-exchange individual market, which is being eaten away by adverse selection under the current Obamacare policy. So maybe something might have to be done about that, just because it can't collapse entirely. But we shall see.
We are at 59 and a half minutes by my count. I think it took us 59 minutes, but I think we may have just found one opportunity for compromise in the new Congress. I think Allison has a deal that she can pitch about taking away that individual mandate. It takes the court case away and perhaps getting something to expand out some of what the ACA is currently doing. So here we go. We have at least one small answer. So I want to thank all three of you. It was a fantastic discussion. So again, I want to thank everyone for tuning in, for the great questions, and thank you, Dan, Allison, and Mark. And everyone can go back to refreshing their internet browsers.